Hi, my name is Mara Antonoff, and I'm a thoracic surgeon at MD Anderson Cancer Center. I'm here with CTSNet at the Society of Thoracic Surgeons 2025 meeting in Los Angeles. I'm delighted to be joined here by Dr. Hayanga. Can you please go ahead and introduce yourself?
My name is Awori Hayanga. I'm a thoracic surgeon at West Virginia University and the Vice Chair of the Workforce of Evidence-Based Surgery.
I'm very excited about one of the sessions that we're going to have tomorrow here at the STS annual meeting related to evidence-based surgery. And I was wondering if you could share with the listeners a little bit about what it is that STS does and what the process is for developing some of these evidence-based guidelines.
Sure, Dr. Antonoff. The development of these guidelines is a means by which our experts, like yourself, can have a voice and a platform to define and articulate consensus documents that help guidelines and that decrease the amount of variability in practice.
Terrific. Are these guidelines mostly helpful for other surgeons? Are they sometimes reviewed by other specialties or thought of as valuable by thoracic medical oncologists or cardiologists in the case of cardiac disease? What is the role of these documents in that regard?
That is a very good question because they're designed to guide thoracic practice for thoracic surgery, but they also serve as reference documents for other subspecialties to understand what we do and why we do it.
Terrific. And this session tomorrow, I think, is particularly valuable. Do you get the sense that most STS members are aware of all of the practice guidelines and what's been published? Do you think there is maybe a knowledge gap there for some of the attendees?
That's an excellent question, and I think that there is a gap. There is maybe a lack of the knowledge that these things exist, that these activities are being conducted, and I think that having the session is a perfect opportunity to let our constituents know what we are collectively doing to try and make a rigorous platform to guide practice.
Terrific. Now, it's my understanding that there are really two general types of guidelines or consensus documents that can be generated by the Society of Thoracic Surgeons. Can you talk our viewers a little bit through what those two types of documents are?
Absolutely, Dr. Antonoff. There are two types, mainly an expert consensus document and a clinical practice guideline. The expert consensus document exists to guide opinion where there isn't the most rigorous of primary scientific data available. And it has a decreased extent of rigor as opposed to the clinical practice guideline, which assumes that there is more evidence to guide a more authoritative stance on a clinical practice.
Terrific. And in terms of the session tomorrow, could you give us a little bit of a preview, a little bit of a taste of what the different consensus papers or guidelines are that are going to be shared?
Absolutely. This has been a very busy year, and the experts have really been working hard to come up with these documents. We have published, I believe, almost 8 in the past 7 months that
Amazing.
will cover topics such as chest tube management after lobectomy, the management of thymomas and mediastinal tumors, the management of oligometastatic disease that you know well about,
Yes,
Dr. Antonoff, and that cover the robotic curriculum for thoracic surgery residents.
That's terrific. So what can attendees at this session hope to get out of the session itself?
That's a great question. We hope that, one, the attendees will understand that this exists and that they can participate.
For sure.
And that, two, there is a concerted effort going into defining these clinical practice guidelines in a way that allows us to uniformize what we do in clinical practice.
That's wonderful. So for folks who maybe don't attend the session tomorrow and are viewing this at a later time through CTSNet, are there ways that they can access these documents to learn more?
Absolutely. And certainly, first, to those who couldn't make it, we say we wish you were here.
Yes.
And secondly, these will be available online through the STS and hopefully through CTSNet so that we can more appropriately and more ably propagate these to our constituents.
Outstanding. This is so helpful. Do you have any other closing thoughts or anything you want to let the viewers know about clinical practice guidelines or consensus statements?
Well, Dr. Anton, I think, one, these are useful because it allows us to have reference documents for what we do. And two, it creates a sense of community when we get together to try and define what we do and then publish it to guide the rest of our constituents and our colleagues in the state of the art.
Terrific. Well, thank you so much for your time. It's been really a pleasure to chat with you and learn from your experiences.
Thank you for all your help, Dr.
All right.
Antonelli.